Okay, hi, it's Dr. Buford. We're just getting started in the right knee. We've already harvested 2 hamstring tendons, and they're very nice. And now we're looking in the medial compartment, and right out of the gate we can see this is a kind of a meniscus ball that we're going to debride here. This is the anterior horn of the medial meniscus. And really what this looks like is remnants of an old bucket handle tear fragment. And that now looks like it's better. It's not going to bother you anymore. We'll get the suction working on the shaver because it's not working yet, and that'll help with our visualization in a minute here. Okay, so we've taken care of that anterior meniscal tear. This is a little bit of the cartilage. I just want to make sure there's nothing excessively loose here. And that feels okay. Next, we're going to look at the posterior horn of this medial meniscus here, because we can see that there's some extensive tearing here, just like the MR showed us. We're going to see if there's anything we can do with it. We know this has been a tear for a long time. And we can see you've got these little flap tears that aren't really repairable. See that there? So the next best thing is what we're doing. We're just going to take out that flap so it doesn't bother you anymore. We like to repair these if there's any chance, but when it's torn like that with a couple or 3 flaps and chronic, the chances of that actually doing worse, trying to put some stitches in, it's pretty high. So I don't think we're leaving any more meniscus. That looks pretty reasonable at this point. This is where the ACL is torn right here. We'll deal with that in a minute. We're going to go ahead and look in the lateral compartment next. Careful here. Okay, so we are looking in the lateral compartment. You have a little bit of a tear in this anterior horn, but that's just minuscule and very easy to deal with. This posterior horn actually looks pretty good. The popliteus tendon over here. Push down. That looks pretty good in the back there. And the articular surface looks pretty good. So we're going to look at the patellofemoral joint next. We'll just rotate the knee like this. And now if we look at the top of the screen, we'll see your patella. And that looks pretty smooth. We'll look at the trochlea, which is the groove here that the patella glides in. We can follow this all the way down to the front of the knee. And that looks pretty good, actually. So What we're going to do now next is make some room for the new graft. But there we're getting a pretty good look at the patella at the top and the trochlea here, all the way down to the front. Table up. Okay, so what we've just done is, you have anything smaller than that? Is place a drill guide right in front of the posterior cruciate ligament. You can see the tip of it there. And we've sized your hamstring tendons. It's a size 8 graft, which is pretty standard. And now we're just going to reach in here and protect the PCL with a little spatula or a spoon. See that? So that way the graft doesn't, the pin doesn't go into the PCL. So hold that there. And now we're going to drill over our guide wire with a size 8mm drill, which matches the size of our graft. Okay. We'll just break through right there. Okay, pull out the spoon. Okay, and we're through. There's our shaver. And there's our tibial tunnel. So now we're going to make a hole in the femur, basically right up here, just like that. Okay, so here you can see we're high in the groove, and we're at about 35. We're going to take out the guide now, or the drill. Okay, what we wanted to show you here is the actual implant going up. This is the endo button device, this little gold thing you see there. We'll pull that up, see how it goes into the tunnel, and then there's a loop of white, almost looks like a cotton rope. And then behind that is the graft. So let me pull back a little bit, Garth. Just hold right there. And we just pull that up all the way into position. And then we just make sure that's snug. Table up, please. Okay, so here's the new graft in position. It looks real good. Got good tension on it. It's heading all the way up to the back. There's a little bit of soft tissue there we can remove. But that looks real good. So we're going to go ahead and finish up here and get you back to the recovery room, okay? I really hope that does the trick for you now. Good luck to you. Bye-bye.